Shirley, I'm Dr. Lester. I'm one of the psychiatrists that they have asked to see some of the patients in the shelter.
Hi, Dr. Lester.
I'll let you start by telling me about why does the staff want you to see me today?
Well, Dr. Lester, since I was just a little girl, I wanted to be a nurse, just like my mom. And I went through school and through high school and went through all the prep courses and was accepted into Kent State. And during my last years of high school, I started having some depression issues and trouble sleeping and things like that, and made it into Kent State and went there about a year, and I learned just about everything I think I needed to learn at Kent State. So I went up to Dr. Linda Page when she was there one day and just told her I think I knew everything that there was to know. And made a lot of good connections there and decided to go to another college and finish my nursing degree. And it was that during that time I think I was a little manic, a little up and down, and had some problems, sometimes with classes, sometimes failing, sometimes not, and finally made it through school and started working, did pretty good, and just married my high school sweetheart, John, and had some problems.
Shirley, let me interrupt you for just a second.
Yeah.
You're giving me a lot of really great information. Why are you seeing me today?
Well,
While in the shelter.
I just had a few issues. I have a part-time job gardening, and I really like that. And they say that maybe some of the chemicals I've been working with maybe caused me to have some hallucinations. So, yeah. So, I'm having trouble sleeping while I'm here. It's making me really nervous. I'm really depressed, and
Are you having hallucinations there?
Well, if you count the spiders that keep dropping on me at night when I'm trying to sleep, yes, maybe. If those aren't real.
Are there really spiders?
I don't know.
Or are other people telling you that they're really there or that they're really not there?
I don't know. I'm having trouble sleeping, so it's been kind of, I'm not sure if they're real or not. I'm not sure. Sure.
Are you hearing any voices?
Just the other people complaining.
Do you ever hear a voice that other people say there's nobody really there talking to you?
Sometimes, yes. Sometimes, yes.
And what might that voice be saying?
Well, it just kind of depends. It keeps telling me I need to get up and get out of here. So, yes, it's talking to me. I really need to get out of here.
And what does that mean?
I don't know.
Does it mean to get out of the shelter?
Yes.
Or to get out of Ashland, or?
No, just out here. But with the storm that came, and the news said that all the homes in Polk where I live, they're all destroyed, and I have nothing to go back to. So I guess I'm stuck
Anybody
here.
there at the shelter with you?
Yes, my mother and my son.
Okay.
And they were with me when we were at Home Depot getting gardening supplies when the storm came through.
Okay. And I'm sorry, you broke up a little bit. You were at home when the tornado came through?
I was at Home Depot getting gardening supplies, yes.
Okay.
Mm-hmm.
And so did you guys see the tornado, or did you see any destruction from the tornado?
We saw the bad weather coming, and we heard the warnings over our cell phones that we needed to take shelter and not go on back to Polk. And we've been through this before. My mother lost her home about 10 years ago.
Gee, sorry. So, you mentioned the hallucinations. Have you ever been, and you mentioned having a manic episode back in college. Have you ever been diagnosed with a mental health problem?
It's quite possible. I do see some doctors, but they're not in Ashland County. I'm not really sure where they're at. I can't remember. And I take medication, but I can't remember what that is too. Okay. And I haven't had it since I've been here.
Did they ever say that you might have had a diagnosis like bipolar disorder or schizoaffective disorder? Now, how often do you have those manic episodes?
Oh, maybe every couple years or so. Every couple years.
And during those times, can you describe, say that again?
Every couple years I kind of go through that episode, yes.
And what sort of symptoms do you have when that happens?
I start seeing things that aren't there, or hearing the voices again. They say that they're not there, but here at the shelter, it's been those spiders that keep dropping from the ceiling.
How much are you sleeping at night?
Not much. It's too hot. I put the covers over my head so that the spiders don't drop, and during the day I have to keep this hat on because I don't want them on my head.
Okay. So you haven't been sleeping. How's your mood been?
Not good. The other people are really annoying.
Would you say it's been kind of more irritable or more depressed?
Both. It's irritating, and I want to get the hell out of here.
How's your appetite been?
How's my what?
Appetite? Your appetite, like, are you eating enough?
Not really. They don't really cook any good food here.
What about though? How was your mood before you came in? Before this all happened and you came to the shelter, how were you doing?
Pretty good. Pretty good. And, I was taking my medication and, holding down a job, and, I've got that part-time job gardening. Everybody wants my expert gardening experience,
That's great.
Mm-hmm.
That's great. So how long have you been off of your medication?
Since I've been here. About 4 days
so
now.
just 3 days. 4 days.
Yes.
Okay. And let me ask you, do you think you would recognize the name of the medication if I were to say it?
Maybe.
Like, have you been on lithium, or Depakote, Tegretol, or Zyprexa, Risperdal, Abilify?
Abilify. That sounds like
Abilify,
one.
okay.
Yep.
Okay. And were you on just one medication, or were you on several medications?
I might have been on 2. I'm pretty sure 2.
I couldn't quite hear that. Did you say 2?
I think 2. 2.
2, okay. And were you taking them in the morning or at night?
1 in the morning and 1 at night.
Okay. Good. And do you remember who your doctor was?
I can't remember.
Or were you linked up with a mental health agency?
Oh, yes. Oh, yes.
Do you know the name of the mental health agency?
Not in this county. Not in this county.
Okay. Now what about hospitalizations? Have you been in a psychiatric hospital before?
No. No, they never hospitalized me.
Sometimes people who have bipolar disorder or schizoaffective disorder also have periods where they get more depressed. Has that been true of you as well?
Oh, yes. In the winter, I get real depressed. I think that they call it that seasonal thing.
Okay. Have you ever had any suicide attempts?
No. No.
No.
Can I take the moment, please? No, he moved from his spot, so. It's Ken's fault.
Okay, Shirley.
Yes.
You're giving me a lot of really good information.
Okay.
How are you feeling here in the shelter today?
Pretty depressed.
Pretty
And
depressed.
I want to get the hell out of here.
Okay. And I think I asked you, but I just want to make sure. Are you having any thoughts about hurting yourself?
No. Just others at this point.
Oh, just others. Who are you thinking about hurting?
I wouldn't go through with it. I would never hurt somebody else, but it's annoying here.
Okay. Okay. So it's more about the hallucinations that you're experiencing.
Yes.
And the depression.
Yes.
Okay. And you think it might have been Abilify that you were on before,
Yes.
but you're not sure. And
sure.
whatever medication you were on is actually helping.
Yes.
Okay. I think what would be, Abilify is actually a pretty reasonable medication given the symptoms that you're reporting right now. It's a good medication that can treat either bipolar disorder or schizoaffective disorder, and it specifically can help with hallucinations.
Okay.
If it's okay with you, what I'd like to do is I'd like to ask the nurse to restart that medication for you.
That would be great. Thank you.
Okay? And then hopefully you don't have to be here at the shelter too long. But if you think you're getting worse and you're still at the shelter, they can always call me back and I can check in and see how we're doing with the medication.
That would be wonderful. Thank you.
Great. Do you have any questions for me?
No.
Okay, so I'd like to start Abilify, 5 milligrams a day. And she can take it in the morning.
Okay. Anything else?
Not right now.
All right.
Just call back as needed.
Okay.
Dr. Lester, we're gonna go on ahead and get ready to bring out our next patient so you don't have to disconnect, okay?
Okay, sounds good.
Okay. Are there any questions for Dr. Lester or myself?